Well, let's get more on this now with Roger Casale, who's a former Member of Parliament for the UK's Labour Party. He joins us now from Milan. Really good to have you back with us, Roger. We heard there quite a bleak outlook for the NHS, despite the fact that it continues to remain revered among the majority of Britons. Tell us in a nutshell, if you can, what needs to be fixed in terms of the UK's National Health Service? How can it be made sustainable into the future?
Yeah, well, good morning and happy birthday to the NHS. And I think that's the right question, if I may say, to think about the future on a day like today. But let's just, before we do that, let's just remember it is 75 years. And Prince William and Kate are meeting the first baby who was born in the National Health Service 1 minute past midnight on 5th of July 1945. And the point was made by Simon that for Britain, the National Health Service is part of its national identity. People were not just born in the NHS, they grew up, they started families, and they think they will die in the NHS from cradle to grave. And as you rightly say, is that concept of a free at point of use health service fit for the 21st century? And to be honest, I think it's going to be surprisingly resilient. I think that the funding the NHS through taxation, as opposed to charges or some other kind of system, is quite an efficient way of doing it. But the problem the health service faces is, number one, the problem that all public services face at a time of economic decline. Britain is suffering economic problems at the moment, and that affects the money that goes to National Health Service. It's not just doctors and nurses who are striking in the UK, it's teachers and everybody across the public sector who are striking. And I think the second big challenge is an ageing population. And the demographic changes. And so the NHS will have to change, but like all great institutions, I think it will be able to do that. Exactly how that's going to happen, well, of course, it's a very politically charged question, because in order to reform the health service, you do have to look at it in quite a critical way. And of course, the Labour government that I was a part of was elected on a huge majority because it said, we will look after the NHS. Even Brexit was driven by the idea that more money would be coming to the NHS. More money does keep coming to the NHS, but the problem is that demand grows faster and faster. But I don't think that dismantling the NHS or trying to find a radically different way of funding it or of structuring it is the way to do it. I think the emphasis needs to be much more on public health and on getting people to take more responsibility for their own health. A lot of the NHS money could be saved that way, I think, if people took more time if there was more of an emphasis on education and public health. But we're always going to have a problem with an aging population, that more and more money is going to have to be spent on health. And I think whatever government of the day it is, whether it's Conservative, Labour, will always have to do that and be able to do that.
Well, that leads me to my next question, because the doctors and nurses who've been striking over the past few months have accused the current Tory government of slashing funding over a number of years to the NHS. But according to the Institute for Fiscal Studies, spending on the NHS could reach a whopping 44% of public spending in 2024-2025. So would it make a difference which government is in power, given the fact that the slice of public spending that the NHS currently consumes is growing year by year? Is it a matter of prioritising depending on which government is in power?
I think whichever government is in power, spending on the NHS will, as a share of national income, will not go down, and I expect it to go up. It might go up slightly faster with one government of the left rather than government of the right, but that will depend on the economic circumstances of the day. But the pressure, the demographic pressure, the demand push, if you like, to spend more on the NHS is so significant that I think it will continue. It will continue to rise. But what we need to focus on is the value that you get from that money and the health outcomes. And the National Health Service does some fantastic work for the very, very difficult cases, particularly end-of-life cases and cancer and heart transplants and so on. If you've got a really serious health problem, the NHS is going to look after you very well. But for minor complaints and other illnesses and so on, and again, I come back to this point about public health. I think there the outcomes are less good. So I think there needs to be a much more of a focus on public health and on people not going home to go to hospital, go into for NHS treatment in the meantime. We have to find a way to manage demand on the health services. It's not just a question of how much money we spend on supply, on the supply side of supplying health services. We have to try and manage demand for health services. And that's difficult when you've got an aging population.
Okay, Roger Casale, we'll have to leave it there, but thanks as always for joining us on the program.